Now over to our second part with meeting and complementarity of expertise, and we'll talk about the Atlas project.
Alors pour cette seconde partie, j'ai le plaisir d'accueillir
Now, for the second part, it is my pleasure to have Ode Kantu Kavenga, the Otis head of country, Anthony Vautier, technical director for the Atlas project at Solthis, who's based in Senegal. On the second panel session, we'll be looking at the ways and means of deploying technical expertise in the field to strengthen the agency and capacity of NGOs and civil society organizations, linking up with national systems as part of the Atlas project. And let's watch a video. You know, screening, my partner has an issue with screening. He doesn't want to go to the medical facility. The reasons why some people would not want to access to healthcare are very varied. Among these reasons, there is the stigma attached to it, but there's also discrimination. The HIV phenomenon has not yet been accepted by communities. People don't come to the medical centers to get screened. Whether you like it or not, there's been a shortfall in terms of the outcomes we achieved. We have greatly neglected these regions, considering that these countries had low epidemic rates, and very clearly, we have not invested into these countries as we should have done. The Atlas project is a project financed by Unit Aid, which is being implemented by a consortium made up of Solthis and IRD in Mali, in Senegal, and in Côte d'Ivoire, in Ivory Coast. This project comes as an addition to conventional screening approaches already in existence in these countries to add to and to improve the knowledge base about HIV status. The Atlas project aims at reducing mortality connected with HIV and AIDS by improving what is called the first 90%. It has three angles to the approach. The first is that it enables the setting up of an environment which facilitates the deployment of self-testing. Number two, to develop with each country, health authority and ministries and civil society organizations to develop well-adapted strategies for distribution, including secondary or indirect distribution, so that self-testing are given out to people who give them out to people around them. And then the third aspect, which is managed by the Institute for Research for Development, is to generate resources and data to share them. It is extremely important to note that 300,000 tests were conducted as part of this project. And above and beyond the health system, we have been able to demonstrate that it was possible to do so in the context of communities. It is fundamental that methods be circulated and disseminated. And all this will contribute to the fact that people who don't know whether they are HIV positive or not will know and then can access treatment. There are no longer any debate on accepting self-screening for HIV in the various countries, be it on the side of decision makers or on the side of target communities. There's very good acceptance of self-screening. All the results we got show that self-screening for HIV is something which is feasible, acceptable, and sustainable over the long term. Dispensing self-testing directly and indirectly makes it possible to reach out to people who didn't have access to screening. Self-screening is not a magical tool, doesn't solve all problems, but it's a valid, effective tool in responding to epidemics and in the area of HIV screening tools. I will now immediately give the floor to Ode Kanku Kabamba and Dr. Aminata Sidibe Kaita to tell us about the Soutoura organization, still part of the Atlas project, to deploy self-screening with very significant results as a result of this collaboration. Hello, my name is Ode Kankou. I'm the head of Mali for Solthis. Hello, everyone. I am Dr. Keita Aminata Sidibe. I'm the project leader in Soutoura. Soutoura is an NGO of Mali which specializes in health and healthcare, and especially for HIV. The organization implements projects across all regions of Mali. I've been supporting key communities in my country in order to promote the use of self-test and self-testing, and I feel very proud to make these communities able to learn to take care of their health. Atlas is a project which goes beyond the mere introduction of self-screening in Senegal, in Mali, and the Ivory Coast. It also promotes scaling up, and in order to crystallize its potential and make it sustainable, it was developed and implemented by giving preference to the most participatory approach possible with all stakeholders at all levels by engaging representatives of users groups and organizations of civil society, as well as national authorities. The project strived to engage in a fully integrated approach connected with national strategies and connected with the existing systems and programs, including public services and especially the community-based initiatives to prevent HIV and screen HIV. With respect to the innovation of self-screening, which was introduced, Solthis built upon its thematic expertise. As you know, fighting against HIV is part of Solthis's DNA and its ability to coordinate complex projects at the regional level, its network of experts, as it combined with the Institute for Research for Development, IRD, for the research activities and working in close collaboration with the World Health Organization. This expertise cannot be sufficient in itself. As soon as the project was developed, it was critical to be able to engage and combine existing areas of expertise in each country. And the civil organization partners added to the general expertise in the project by contributing their in-depth knowledge of the context and the key communities, and also contributing their knowledge so that well-adapted initiatives and action to engage in prevention and community-based screening could be developed. So the partnership dimension and the sharing and exchanging of expertise were key elements, and these led to the signing of partnership agreements with some 20 civil society organizations, which made it possible to distribute 90% of the self-test, i.e. more than 330,000 self-tests were distributed across communities for the key communities and their networks. Now, the partnership and participatory dynamics was not limited to the signing of agreements between organizations. The Atlas project made it possible to take the time needed to jointly develop self-screening strategies. Many consultations have made it possible to engage representatives from patients and members of the various organizations so that together we were able to define how we would integrate the diagnostic self-test in our activities. We also fully contributed to the development of new tools to be used by dispensing agents. These aspects are of critical importance because we know how things are done in the field. We know what works and what doesn't work, especially the specific way to work with key communities. And this requires an in-depth knowledge of the environment and the milieu. This has made it possible to fully embrace the self-screening tools right from the beginning, and has made it possible to include these tools quite easily into our activities with little difficulty. Self-screening came as an addition to a large range of community-centered services by helping people which we couldn't reach out to in the past. Self-screening was very well accepted and has made it possible to reach out to networks of patients and users thanks to the recirculation of self-tests. And this has convinced some people to engage in screening as they didn't want to do it in the past, it being confidential, and it build a capacity for beneficiaries who are more at ease to engage in self-testing when they want it, as they want it, with the people they want. At the beginning of the Atlas project, self-screening was a new feature in Western Africa, even though we had experience feedback and results from surveys and studies in other countries, knowing that the context of these countries were very often very different. So we had to learn as we went how the self-testing would be received, how we would have to adapt to improve the implementation of the project. So it was important to learn as we went and to adapt together the methods and activities to dispense the self-tests, taking into consideration the observations, remarks, and statements made by the community people. We have tried to engage in a continual learning process by using collaborative methods, reporting and sharing experience to define avenues for improvement. It was key that experience by one partner could be shared by others to enable mutual enrichment. We set up focus groups with dispensing agents twice a year. These focus groups made it possible to give a voice to those people living and working closest to the users. These consultations were analyzed and reported back during meetings with all partners, and this has made it possible to take stock of successes and of challenges and obstacles and to draw lessons. In each country and at the end of each year, we would bring together all stakeholders to share results, to speak about their practices, about their assessments, and to share new knowledge extracted from research or from international recommendations. These moments for sharing have made it possible to share and exchange and also to define things together to decide which adaptations were required and necessary. So the implementation of the Atlas project has involved setting up a number of bodies in the 3 member states. First, they participated in technical working groups and subgroups involving working on contextualization, the various training modules. We are members of the pool of national trainers on self-screening diagnosis tool. We participated in cognitive text during the design of additional brochures. We participated in validating messages in national languages to support the videos and the awareness raising materials. Secondly, a quarterly project committee meeting helped monitor the implementation, both at the operational and budget level. This enabled great participation into the studies, including the launch of qualitative studies. And this participation in the consortium meeting helped us share and exchange with researchers and also has made it possible to set up a network jointly with Senegal and the Ivory Coast, which went beyond the Atlas project. Thank you very much. Now, by way of conclusion, I would like to give the floor to Anthony Gauthier, who is the technical director of the Atlas project, so that he reviews and shares with us the key challenges, as well as some recommendations as to the best way to set up these type of projects.
Anthony?
Thank you, Anthony. Thank you, Hélène. Thank you, Hélène. Hello, everyone. As was very well illustrated by Ode and Dr. Aminata in what they said, it is clear that we need to invest in a continual dialogue and collaboration with civil society organizations, which makes it possible to foster both inclusion, incorporation, and transition and scaling up of an innovation like self-screening based on our experiments experiments and experience. Some learnings have been drawn and recommendations can be put forward. First, it is essential that we can initiate collaboration upfront as soon as the project is designed, upstream from executing the project at the time when the project is being designed. This is a real challenge. This was a challenge for the Atlas project. Very often, time upstream from the project does not make it possible to enter into in-depth partnership mechanisms. So this is to be done in second phase. The second recommendation and the second challenge, in fact, is to incorporate and dedicate sufficient time to build up collaboration upfront as soon as the project starts, when it hasn't been possible to do it before the project was launched. And we paid special attention to this point, and we took between 6 to 9 months time to build up some 20 partnerships across 20 countries to jointly define rollout strategies, collaborative methodology, and joint working mechanisms. And the third and last recommendation and challenge is to reach well-balanced consensus in the way we introduce such an innovation. Self-screening was a new feature in the sub-region. Yet, in a logic of inclusion and integration, it was being delivered by programs which were funded by other financial partners. So we had to take time enough to discuss how integration could be done and could go ahead at the operational level, and to see how budget could be linked up so that things can go smoothly. So to me, these are the three key recommendations I want to share with you, following what Ode and Aminata just told you.
Merci Anthony. Eh bien,
Thank you, Anthony.
Ouvrir les questions et Ode et Aminata
Let's
sont
move on
bien là avec
to
nous,
questions and answers, and we have Ode and Aminata to answer the questions.
Peut-être pour commencer, une
So
question
to start off,
sur
let's have a
la
question
nécessité d'avoir du temps de
on the
construction.
need
Anthony
to have
en a
time
reparlé.
to
Ce temps de construction de
design
partenariat en
and
amont, c'est
develop
quelque chose
the
qui dégage
partnership
pas mal des
upstream
interventions qui ont été
from
mises en place
project
et de la
deployment.
construction du
This has
programme.
been
Est-ce que vous
mentioned
pourriez un petit peu
that it should
développer
happen
là-dessus et voir
ahead
comment ça s'est
of
organisé
the
et peut-être
implementation of the
aussi
program?
les
Can you tell us
négociations qui ont
how
été
it
nécessaires
went
avec le bailleur,
and what
puisque
type of
c'est aussi ça qu'il
negotiations you
faut
had
parfois
to engage in with the
pouvoir
donors?
discuter?
Because these are very often points for discussions, aren't they? Yes, let me expand on this.
Pour le contextualiser,
says,
comme on le mentionnait, le projet Atlas a été
so the Atlas project was funded and supported by UNITAID,
qui fort heureusement permet d'avoir une
which
période de développement et de conceptualisation du projet en amont du
provides
démarrage,
a time period for conceptualizing, designing, and developing the project in between 6 to 9 months, which is not always the case with all donors and financial partners. And it was a great opportunity for us to start developing the partnership logics across several countries and across several and many partners. Having said that, this time period, even though it makes it possible to refine the strategy and mechanisms of the project at the regional level and for each country, this has made it possible to initiate contacts and collaboration with some historical partners for Solthis, but did not make it possible to come up with something which was very accurate and precise at the time when the project was designed. This is why I talked about the second challenge, to take time enough at the start of the project, when the project is launched, which goes against what donors are expecting and asking for. They want quick results, but in the first few months, when the project is launched, it is important that we start developing partnerships even before we try and get results, because this time period, which people might think as wasted time, is huge gains and efficiencies and an upside at the finish line with respect to sustainability and scalability of the project. So the takeaway message is this principle that if you want to progress and advance empowerment and building capacity for civil society organizations that
une petite révolution en termes de méthodologie de
should
construction de
accept
projet et de
to
financement
fund
de projet,
things even
c'est-à-dire
before
avant même que
the
celui-ci ne
project
mette en place
start,
les
that is
activités
even
qu'ils vont
before the
promouvoir.
project starts
Je trouve ça
developing its
vraiment
activities, that
intéressant.
it should be
Une question
funded to
complémentaire, le
start
projet
developing a
Atlas
fundamental
travaille-t-il
mechanism.
avec la
Now,
cellule de
does
lutte
the
contre
Atlas
le sida
project
dans les
work
pays?
with the AIDS control unit? This is a question.
Peut-être une réponse du Mali?
Answer by Mali, possibly?
Ouais, justement, peut-être que je
Well,
peux
indeed,
rebondir là-dessus.
I may try and
Le
answer
projet
this
Atlas
question.
a déjà, dans
The
sa
Atlas
phase
project, in its
d'élaboration, avait associé
design and
le
development
secrétariat
phase,
exécutif de
had
lutte contre
combined the executive
le VIH au
secretariat
Mali et
of
aussi la cellule sectorielle de lutte contre le
HIV
VIH
control, as
qui
well
travaille
as
avec le projet Atlas. Et dans la phase
HIV
de mise
control
en œuvre, le
sectorial
projet
unit,
Atlas
so
a
two
commencé
organizations.
d'abord
And in
par
the
signer
implementation phase, the
une
Atlas
convention
project
de
started
mise
with
en
signing
œuvre
an agreement
avec la cellule sectorielle
of
qui
implementation
accompagne en fait le projet
with
dans
the
tout ce qu'il y a
AIDS
comme
control sectorial
activité dans la
unit,
mise
which
en
has
œuvre, ainsi
helped
que dans
the Atlas
l'évaluation. Donc c'est une
project into
collaboration
the
très étroite
implementation
entre le projet Atlas et
in the
la
format of
cellule sectorielle.
close collaboration between the two organizations.
Merci beaucoup.
Thank you very
Bah,
much.
écoutez, merci à tous les trois pour votre
I would like to
participation.
thank
On
the three of
va
you
enchaîner directement,
for
mais
your
encore une fois,
contributions.